Welcome to 20-Minute Health Talk. I'm your host, Rob Hoyle, and today we have two amazing leaders from Northwell Health's Center for Emergency Medical Services. It's probably not a field that got turned upside down more than the EMS field during COVID. Today, we're being joined with Bernard Robinson, who's the Director of Operations for the Center for Emergency Medical Services at Northwell, and Tara McEvoy, who is a paramedic supervisor. Thank you so much for joining us here on 20-Minute Health Talk. Tell me how you guys were able to adapt during COVID.
Sure. Well, thanks for having us. I appreciate that and the chance to be heard. It is still ongoing. It's a time of anxiety, especially in the initial phase when everything started to happen. There was a lot of uncertainty, a lot of information that we weren't sure if it was correct or not, a lot of changing information. And that had our crews, our EMTs and the medics quite anxious, to be honest. So that was a trying time. And it's funny, not really funny, but here we are a year later and we're still going through it and we're still here and we're still, following those same guidelines. So it's been a long year and the fatigue, you start to feel that fatigue.
Has COVID changed EMS?
Yes, I think that one of the things you'll find is that people will be wearing masks even after the mask mandate's gone. Because you think back now, it's like, why weren't we wearing masks all this time going into hospitals? They're more aware of the opportunities to get yourself infected or bring something home. And the whole big thing is to never bring anything home to your family. So,
wow.
Yeah, it definitely makes you think about all the things you've been exposed to and the possibilities and potential to be exposed. And I think everybody has that heightened alert sense of, I'm not touching that. I'm going to put a mask on right now. So that's a positive. That's a positive. It's keeping people safe, and
keeping you safe and keeping the patient safe.
Absolutely,
you never know. Yeah. And speaking of bringing it home to your family, Bernard, you got COVID and you got really sick. Just tell us a little bit about your experience with COVID.
Yeah, sure. That was actually a year ago. Last March, I decided to go out into the field and assist with the crews and help them out. Like I said, anxiety was high. And I just figured it would serve better to be out there with the staff and out there with them on the front line instead of being back, in the office or something like that. So I went out on the overnight shift to facilitate some transfers out of our more crowded hospitals. At that time was LIJ Valley Stream and LIJ Forest Hills. And somewhere in between the first or second night, I actually got exposed, got very ill, ended up being hospitalized twice, admitted to Manhasset, went through every symptom, quarantined in my basement. Just not being able to breathe was horrible. And thankfully, I did, things turned around. I got better and was able to get back out here with everybody else.
Tara, what's it like for you and for the people that you supervise when they know somebody like Bernard is very sick? How much fear, how do you guys get through that and continue to do your jobs?
Well, it was actually terrible because everybody was very worried about him because we knew how sick he was and we were watching people dying from this. And it was like, because you care about the people, you're your family. And so for us, for the supervisors to deal with the crews, they would ask about him, how is he doing? And we try to give updates and try to stay positive, but you're also like reminding them, make sure that you're washing your hands and using sanitizer. It's really a lot of precaution that you try to remind them of. And I think worrying about him made everybody a little bit closer, even at that moment, just because it bonds you. Sure.
And how do you inspire the crew to go out and keep doing the life-saving things that are so necessary?
You do it with them. You listen to them. Everybody wanted to tell their story. Everybody had a horrible job. You have to listen. I listened to more horror stories. I saw them myself. I was out there. And just to let them talk through it, because this was nothing that you've ever seen. Like, right. I worked through the AIDS pandemic back in the 90s and this was nothing. That was scary. This was terrifying.
Bernard, I know that you're part of this national task force that focuses on diversity and inclusion. Can you tell us a little bit about that?
Absolutely. So I'm part of a task force which is run by the National Registry of EMTs and Paramedics. I was asked to sit on this task force by the Ambulance Association of America. So I represent that organization as well as Northwell and our department. And it's a task force designed to address the issues of inclusion, diversity, equity, and access within the EMS community, which is something that, it's long overdue. If you look at the numbers, 75% on a nationwide basis, 75% of EMS professionals are male, 85% of EMS professionals nationally are non-minorities, and that does not, effectively or accurately represent the communities that, we serve. We all know there's a lot of different healthcare disparities in different communities, underserved communities. And a lot of that is based on mistrust that these communities have because the providers, and it's a miscommunication. The providers may not understand a community that they're not a part of, or a culture, and it's vice versa. So that kind of helps to strengthen that distrust. But when you work on diversifying your staff, you work on diversifying the different cultures and representing different cultures, it makes that communication much easier and builds that trust. And I think that that's something that Northwell is definitely on the right track of doing and doing a great job of it. And it just, we continue doing that, and that trust will grow. And that's something that it's important to me. And to remember that it's not only diversity. Diversity is good, but it's diversity and inclusion.
Sure.
And and that's something that, I think I'm passionate about that as well, that, we do need to diversify our leadership and have that reflect. That's the only way you're going to get ideas addressed that affect other communities, is by having those diverse opinions.
So Tara, what has it been like, your experience being a woman in this field of mostly men?
It's challenging at times. It's gotten a little better over the years. When I started, women were just, nobody knew how to speak to you. It was, whether it was cops or firemen or patients or people walking in the street, everybody thought that they are allowed to judge you or tell you how you look or tell you, you get a lot of, oh, my heart's breaking for you, I need mouth to mouth, those kind of comments, and you're objectified. And it's gotten better. It's, slowly, kind of too slow, but to have diversity and inclusion, it's, making people understand that we're here and we should be given the same respect that a man would be given because we're doing the same job. So it used to be a man's world, but there's a lot more women in the field now. Not enough, but a lot more.
Bernard, what lessons have you taken from this national task force and applied here to Northwell?
So one of the first things is that you have to identify what the issue is and that there is actually an issue. Another thing I learned is that being open-minded, you have to be open-minded when you're dealing with issues of diversity and inclusion. We talk about cultural competence. An organization that has cultural competence is one that can effectively operate within multiple cultures. Then we have cultural humility, which is the inquisitiveness or wanting to learn about other cultures. And the more you want to learn, the more you talk, the more you're open to communicate, the smoother these kind of interactions will go, and the better the relationship and communication will be. So that's something that we bring. I've brought over, having diverse conversations with diverse groups. We have a diversity and inclusion committee at our department where we discuss these kind of issues. We talk about microaggressions. We've talked about implicit bias, and that's on a department level, but it kind of opens up people's minds to, all right, maybe I am a little guilty of this. This is something I need to work at, and self-reflection is where it needs to begin. We have been told on national levels by organizations that this is not a problem with my organization. That's not true,
right,
but
sure.
but some people refuse to believe that this is something that needs to be addressed. And this task force is designed to address those kind of issues regarding recruitment, regarding education, retention, training. How do we get those numbers to change? Where are we recruiting our staff from? What areas, what neighborhoods? A lot of neighborhoods don't even know how to get a job like this, or where do we even start? I wouldn't have known how to get into EMS had my father not worked in EMS. I'll have no idea. And I don't know how many times I've been asked by people when I was sitting in the ambulance, how do you get this job? How do you, they don't know.
Right.
So it's about where are you recruiting from? And some states have pipeline programs where they go into communities and set people up with training.